The families we will meet in this series are facing one of the most confronting experiences of their lives. Their children are critically ill, and the local hospitals looking after them don't have the specialised emergency care they need.
She's actually getting tighter. I'm not getting on top of it.
Over the next few weeks, we follow the doctors and nurses who work with NETS, a neonatal and paediatric emergency transport service that brings intensive care to the sick child's bedside, stabilises them,
right now our focus is on making sure he gets all the right things done,
and then travels with them to a specialist hospital. This gives critically ill children their best chance of survival. Becky and Rose are on a helicopter retrieval to Gosford.
Well, whoever's coming in will have to get changed.
Where do we get changed? We've basically been asked to gown up because we're in the sterile operating theatre environment, and it's really for the sake of the cleanliness of the room and the other patients who are in the operating theatres next door.
Hello.
Hello.
Nice to meet you.
Nice to meet you.
Welcome to the Mayor House.
20-month-old Jacob has a bacterial infection. A sore throat has suddenly escalated into a life-threatening illness.
His particular condition, his airway was so swollen that they could only fit a small tube down his airway. The size of tube we needed to use was about the size that you would use for a newborn baby.
Like I said, he's getting anaesthetic. He doesn't know what's going on at all. It's bad for the parents. For him, he's quite comfortable and relaxed at the moment.
Within 2 hours, he had gone from sort of a little boy that was just sick to a little boy that had stopped breathing. So I was very sick, and the doctor brought a counsellor up, and then that's when I knew that there was a problem.
I had a phone call from Janine, and I just pinched the boss's car, took off. It was the longest 10 minutes of my life.
How well was that?
I haven't come across looking after a boy that sick before. I mean, obviously I've looked after children that are ventilated and everything, but I've never come across the secretions that he had.
He's a very sick little boy, and so we have things under control, but in terms of kind of absolutely stable, there is still that possibility that he could get worse before he gets better. But I'll sit down with you and have a longer talk about that when we're almost ready to go. Okay.
Yeah.
well, I've got both of you because I don't know what time it's going to be, so we both have a listen. But last time we transferred...
Back at NetSpace, Senior Dr Neil Atherton and Biomedical Engineer Colin Williams are briefing the teams on standby about a piece of equipment that will be needed for a retrieval scheduled later in the day.
The harmony. There should be a little small socket.
That'll flash the whole time we're on battery?
Yep.
The easiest thing you've shown me so far, Colin. On the bed state, Raw North Shore is amber, but they've got -1.
Meanwhile, NETS nurse Heather Robb, who's doing the daytime coordination shift, is trying to find a bed for Jacob Hooley.
It's a statewide service letting us know all the neonatal and paediatric intensive care beds that are available, and it's actually set up like traffic lights. So you've got red, amber and green.
So everything's...
Before he can be transferred, Jacob's breathing support needs to be switched over to the NETS ventilator. This is a critical time. Becky and Rose have to watch the monitors closely to make sure Jacob's condition does not deteriorate.
So airway, so ET02 is 56. Should we do another gas on our... I think we're going to move 5 minutes on our ventilator and then we'll do gas. Yeah. We can adjust the pressures here.
Okay, this is a 30-week baby was born at home at about 8 o'clock this morning. Probably 30 weeks. Baby was born at home at about 8 o'clock this morning. Initially was okay, came in by ambulance and started grunting.
Dr Claire Bettridge and Nets nurse Jane Roxburgh are on their way to Auburn Hospital, where the resident on duty needs their support to manage a newborn baby.
One of the main problems before we got there was that the hospital had been unable to get any IV access in the baby. Children are very small and they've got very small veins, and it is hard to find, so they hadn't been able to give her any antibiotics or any fluids, which is really what the baby needed. Yeah, because she was a breech delivery, the legs can sometimes just get a bit squashed, and they can get very, very bruised. And it's you can't see veins if there's a lot of bruising there. You're looking for something blue in pale skin, and if it's all blue, you can't find it.
We're just going to have a look at your little girl, and then we'll be able to tell you a bit more of what we'll do. So, do you want to ask any questions? No, not right now.
A 30-week baby can be very variable. They can be really good, and they can be very, very sick. So they're still over 2.5 months premature.
There we go. We can see you.
An air ambulance will take Dr Sarah Dalton and nurse Katrina Richardson to Griffith,
Nice evening for a fly.
a large country town about 400 kilometres southwest of Sydney. They're going to pick up what Nets calls a frequent flyer, a child with a chronic illness who regularly needs the sort of care a regional hospital cannot provide.
I'm going to put a line into her belly button, which is a very easy way of getting a line into a baby. We'll start with that. It's fairly quick and simple.
I actually gave birth to her in the bathroom at a friend's place. I didn't know I was in labour, so it was a bit of a shock.
Little artery popping out to say hello.
Because she's my first baby, I didn't know what was happening, so I just thought it was just a sore stomach. I was expecting more pain, you know, what you see on TV.
Okay, thank you. I'll put the rest in here.
I'm Sarah. I'm the doctor. It's nice to meet you, Tracy.
The Thornton family are old hands at this. 15-year-old Tracy suffers from a condition called myotonic dystrophy.
We've just been hearing from the nurses about what's been happening with Tracy today. So my plan is to have a look at Tracy and then a quick chat to you, but then to do a blood test. What do you want to tell me? Nothing? I'm going to sit down and have a little look at you, okay? And we're not going to do anything that's going to show anybody anything they're not allowed to see, all right? I'm just going to take your pulse to start with, okay? I've got cold hands because I've been on an aeroplane, I'm sorry. Myotonic dystrophy is a genetic disease that affects the muscles, and gradually as you get older they get weaker and weaker, which means that you can't walk, you can't feed yourself, and the muscles of your lungs or your diaphragm stops working as well. So you can't breathe as well as you used to be able to. I'm just going to listen up the top, okay? Warmed it up a bit for you now. All right, good girl. And on 2, I think. What I need to do, I'm sorry, I'm really, really sorry. Unfortunately, there's no other way of me doing this, okay? There's no other way except for doing the blood test. And I know you don't like it, and I'm sorry, but we'll do it as best we can so that it doesn't hurt as much as we can, all right?
Come on, you be brave.
Do you want Dad to hold your hand? Come over this side and help hold your hand. You want me to or Mum to? Me. Okay. Oh, I'll hold your hand then, okay? And I'll tell you everything that I'm going to do, so there's no surprises. Okay, it's running again. That's just this going. Yeah. I'll just put it.
Back at Gosford Hospital, an inspection of Jacob's breathing tube reveals a disturbing development.
It's gunky.
It's gunky.
That's all in his lungs, is it?
Are you going to be right, Mum?
Yeah, I'll be all right. I've got to be on the mum.
Yeah. Mum's got to be all right.
It's not till afterwards that you go.
Till the bubbies are better.
Cow.
Yeah, that's it. Till they're better.
That's right.
You're brave, aren't you?
Yeah, she's very brave.
You've got a great sticker today. Thanks for being brave too, eh?
You need another one now.
You're being very good. These things can take a little while, I'm afraid. No, well, I thought I could feel one, but because she's quite slim, you can actually feel the sinew. Lots of children who have problems where they have to go to hospital a lot, their veins end up packing up and not working. So unfortunately it's very difficult to get access for Tracy. You just wish that you could get a magic wand to make these things go in for these kids, because they're always really hard. So I'm going to swap sides with your dad. Right, I'm sorry, sweetie, I wish I had a choice, like I said. Good girl. No matter what happens, this is the last one, all right? I'm not going to make you go through anything else. Last one for real this time.
One more.
One more. Good girl, thank you. I do exactly the same thing. That's it, I'm not going to do it anymore.
No more?
Yeah. No more needles. Look, it's in. I'll flush it. Hooray!
You got one.
Hooray! Tracy, well done. After all that, young lady, you've been the bravest girl in the world and it's all over. All right?
It's just a different feeling. The emotions of being a new mum. I was worried because before I was taken to see her, one of the doctors was saying that she had a 50-50 chance of surviving because her lungs weren't fully developed, so I didn't know what to expect.
So I bet you never thought you were going to be a nurse when you grew up, I bet.
That was it. I hated hospital.
Did you? Well, you probably hate them even more now, I'd say.
And once you've got the problem, you've got to more or less grin and bear it. That's the main thing.
That's what a lot of people say to me, that you just do your best and you all do fantastic jobs.
Well, I've got good contacts with my doctors,
good.
So that's one good thing. But see, a lot of things, I haven't got an oxygen measure at home.
Yep.
So I don't know where oxygen levels are.
Mm-hmm.
So as I don't know, all I've got to do is look for the blue signs. And then I know.
Which you've now learnt how to see.
Very well.
Yeah.
Sorry, mate.
Becky and Rose are close to leaving with Jacob, but he still isn't as stable as they want him to be.
Okay, you won't get us to leave before we're ready. That's why we bring all the equipment with us. So that we can take as long as we need to. We bring the intensive care units to the patients and not the other way round.
Not that I want to go home.
Oh, I know. They got the milk?
No, we're going to pizza because it's my stepdaughter's 14th birthday. Pizza for tea. But that's all right, it's just as important.
The nurse that was in theatres with us was fantastic. She never left. I mean, I said at one point, you can leave if you want to, but I didn't really want her to go.
So, there's Jacob, and who else is it? He's got a older sister. Older sister. Yeah. Oh well, I mean he'll come good. Just. Hello.
Hello, it's Chris Webber.
Hi, Chris.
Hi, Becky.
I'm phoning from Gosford Hospital about a little boy called Jacob Hooley. Let me go through the story for you, because I think I'd find it helpful too. He is a little boy, he's 20 months old. We're working on one thing that people might find surprising is that you actually feel better supported than in a ward environment. And that's simply because you know that you have all of the resources in New South Wales available to you on the end of the telephone. There's a lot of pus coming up from below the cords.
Okay. Yeah. Yeah, that is worrying.
You could call up any specialist in any specialty. It makes you feel very safe.
I guess my plan is to move her onto maintenance, and really apart from the BiPAP that we've previously discussed, I hope there's no need for anything else. No problem. Thanks, Jane. Bye. Okay, nothing else needed, so we'll just get organised.
The machine that helps Tracy breathe has been modified since the last time Nets took her to Sydney.
I can't see where this plugs into it. Stuart, is it?
A call to check the fittings before they left has not helped. The plug from Net's portable battery pack doesn't fit.
There's absolutely nowhere that can plug in.
No.
Okay. Right. We have an equipment problem. There's no actual access point for that on the BiPAP machine. I guess, unfortunately, the bottom line is that we're not going to be able to go to Sydney on BiPAP. And unfortunately, when you're stuck between a rock and a hard place, you've got to only go with the only option that exists, and I think that is CPAP. Now, I'm not happy to transport without making sure, firstly, that she can tolerate it, and secondly, that ICU is happy with it. But I just don't, unfortunately, see that we have any option.
Well, it looks like we're running out of them anyway, real quick.
Can you think of anything else?
Not really. Let's
No.
see. Well, what I'm nervous about is if she has a crash up there, as in her stats will drop while we're up in the air. If that happens, she'll need some support, right? And if we can't use our BiPAP machine, we're going to have to go to CPAP. Now CPAP is a different pressure to BiPAP, right? With Tracy's BiPAP, it pushes air in, right? Where this one just holds pressure inside her lungs. That's the other machine that they're using here now, and we've just got to hope that it works when we get up there. So that's what I'm nervous about at the moment.
Such a shock. So did she just kind of pop out? So you just thought you were having some abdominal pains, and then suddenly there was a baby.
Really bad, crazy.
Yeah. She's doing really well at the moment. As you know, she's only 30 weeks, and they can have problems with her breathing, but she hasn't given any signs that she's having any trouble with her breathing at all. She's in air, which is for a baby this young is very, very good. She's coping extremely well. And as I said, the result of that blood gas that we did shows she's coping remarkably well.
We named her Elena, which is a mix of my father and my mother's name, because she's their first grandchild. Her middle name's Lily, after Sam's sister.
On arrival, the baby was in about 30% oxygen.
I'm glad I got a daughter because I always wanted a daughter. So I got a beautiful daughter. So I'm feel really happy now.
Really? We're fairly ready to leave, I think. So is there anything else you'd like me to do? No? Okay. All right, thanks very much. Bye.
And his chest expansion is not as good.
After consulting with Dr. Webber, Becky is still not satisfied that Jacob can be moved safely.
Can you set me up with a bag?
Yep.
Rather than the ventilator.
Do you want to sit up the ventilator as well?
No, I just want to see want to bag him with something where I can just play around a little bit more and know what I'm doing. You can use the feel of the bag, which is basically just squeezing air down the tube and into the lungs to see what the lungs feel like. You actually get a kind of sensation of what's on the other end. Mind just supporting this for me? It's very useful to kind of actually feel what you're doing, because of course once the patient's on the ventilator, the machine just delivers whatever size breath you've asked it to deliver. It's really stiff to bag. 30. But you actually get more information using your hand on that bag. That's up to 42. Which is what the ventilator's producing. That's 50. We need a good hoover out, little man.
Is that all right? Huh? Yeah? Think you can handle that for a while? Huh?
She might split a little bit lower down.
Right?
The CPAP machine seems to be working well enough for Tracy.
Okay, I think we might finally be ready.
the doctor. And hi.
Okay, 30-week baby. She was born at home this morning. Mum just thought she was having a bad abdominal cramp, and then out came the baby. Baby was breech. Ambulance arrived after a couple of minutes and took the baby straight to hospital. Mum's 27, I think. 27. Yeah. Use this for now. Yeah. She's so sweet.
This ward caters specially for newborn babies. As soon as Elena's mum and dad arrive, they'll be closely involved in her care.
Shall we go? Let's go.
Jacob's condition has deteriorated.
Can we just pop him back on our ventilator?
Despite their best efforts to stabilise him, there's no prospect of leaving anytime soon.
Okay.
Yeah, I want to bridge that gap.
I couldn't do anything, so that was the worst part for me. I was helpless. Whereas normally I can get in and fix something, but this time I had to stay out of the way and just be there for Janine mainly. I couldn't do anything for him.
Can we put him back on yours? It's not great movement, is it?
I think I called on Peter a lot for support. Like, we've been together since we were 15, so we've grown up together. There's sort of never really been anyone else for either of us.
You ready? Is that on?
We give each other a hard time, but we know when to support each other too. We always have.
It's really, really stiff to bag now, and I think it's just a blocked tube. And I'm just, with the history of such a difficult, dodgy airway.
Becky has called the on-duty anaesthetist for help.
Do you mind if I have your film?
I mean, this...
38 on 5.
and it's, yeah.
Tracy's journey with Nets is over for now, but there will be other trips to Sydney.
Start getting some of these off, shall we?
Just pop this on that arm for once, just for a little bit until we get.
No matter what level of expertise they need to call on in the future, Tracy's ongoing care will always be in the hands of her dad.
See, that cannula wasn't working, so they were only putting in like 10 mils an hour or something.
See you later. Bye-bye. See ya.
Go home.
Is anyone else out? Everybody's out.
Okay, now Becky, what I might get you to do is can someone hold that there because we don't want to lose that.
In Gosford, the team work hard to keep Jacob breathing. Last time, we met 9-year-old Rachel in the middle of her first severe attack of asthma.
You just need to relax.
After 5 days in hospital, Rachel returned to her normal active life.
I think she's become more in tune with her asthmatic condition. Initially, she became concerned that every little wheeze or a cough or something might turn into a major ordeal. But I think she's begun to be aware of the fact that she needs to take care of her health.
My mum said it will help me if I would do some running for my breathing. So I started that, and that has been helping it.
Next time on Handle with Care, Jacob's fight for life continues.
Does it actually feel any easier?
No, it feels just the same. 1, 2, 3, roll.
A car accident leaves Corey with possible brain damage.
How would you get here?
And tiny Mina shows just how resilient a baby can be.
It seems odd that, you know, given that our job is transporting and moving kids long distances, often the shortest distance is the one that's most critical.